Guys, today I'm going to share with you what is in my first aid kit as an ER nurse, trauma nurse, all that good stuff. Let's go over the stuff on the table. What's up, guys? Welcome back to the channel. Today I just want to do a first aid kit. This would be from the view of an ER nurse. I've been an ER nurse for 4 years. I'm also a trauma nurse. I've worked in level 1, level 2, level 3 trauma centers. And I also teach for the Emergency Nurses Association. I teach a course called TNCC, which is Trauma Nurse Core Class for Nurses. If you guys do like today's content, please do like, subscribe, and comment down below. And let's go ahead and get started. So guys, I have laid out here on the table just some stuff that I have in my first aid kit. There's also some stuff here on the right that I will move the camera over for in a little bit. But let's go ahead and go over some of the stuff on the table. And I won't make it too long, just some stuff that you guys might want to consider having with you. Alright guys, this first pack here just has alcohol pads, sanitizing pads, that type of stuff, triple antibiotic ointment, and this is an eye wash. This actually came in a kit that I got about a few years ago or so. But anyway, all good stuff to have. Always want to clean stuff, sterilize stuff best you can out in the field. So there's that. I have tons of gloves, guys, tons of gloves. These are the 2 that came with it, but you need more than 2. So I probably have about 10 pairs or so in there. You never know when someone else might be needing to help you out. So we got some gloves there. Let's go ahead and start on the top left up here. Tons of gauze options, as well as a triangular bandage. We don't use this specifically in the ER, but pre-hospital, the medics will use this. They use this a lot for, probably slings is the main thing they use this for, but you could always use this for extra gauze, extra pressure. You can tie stuff off with this. So triangular bandage, pretty good to have in your kit. You know, someone has a humeral fracture or a clavicle fracture, you'll want to put them in a sling. So this is a good one to put them in. Just remember, if you guys are slinging people, you want their elbow about 90 degrees. Just more gauze here, guys, different sizes. Curlex. We have an ABD pad. I know a lot of people on YouTube just call these 5x9s. In the ER world, we call them ABD pad, abdominal pad. Basically, if there's tons of bleeding, there's a pretty thick pad you can just place on someone's wound and then use either, Ace bandage, Coban, Israeli bandage, whatever you want. There's just an extra pad for that. This is a Tegaderm. If you guys have ever had an IV, this generally is what's put over your IV. It's a clear plastic, kind of a plastic style or transparent film there. So if you had a skin tear or something, you could put this on there and you'd be able to monitor what it looks like underneath. So for some reason, if you need to be able to see what's under, this isn't a bad option here. Wouldn't be my first option for most first aid kit stuff, but I like to have one on there. Just some more sterile gauze here, guys. Everybody knows how to use gauze, I'm pretty sure. This is a petroleum dressing. You can buy this pretty much CVS, Walgreens, all that type of stuff. The main use for this would be a penetrating injury to the chest area. You don't want to, generally don't, or you're not going to have a lot of blood coming out, but you might have an open chest wound. So you open this up, you place the gauze directly on it. The good thing about this package is if you have a exit wound on the back, you could use the back of this package because you want to put a non-occlusive dressing on there. Maybe I'll do a video on that if you guys are interested. But this is good for penetrated injuries to the chest. Next on the table we have emergency blanket as well as a cold compress. Some people treat them in the ER don't really know the difference between hot and cold. This isn't gonna be like a heating pad, but I'll just go over my spiel real quick. If you're early in the injury and you're having a lot of swelling, you want to use cold because that will slow down the blood flow there and not cause swelling. If you're a few days into the injury and you want to switch to heat, that's fine. The heat actually opens up the blood vessels and that allows for more healing. But let's say you sprain your ankle, you don't want to put heat on there because that's going to have more blood going there and it's going to be more swollen. So anyway, we use an acronym called RICE. So rest, ice, compress, and elevate. If you have some type of bone or joint injury, please use RICE. You want to use cold first. Emergency blanket. So there's a lot of studies. There's basically a triad of what can kill you if you're a trauma patient, and being hypothermic is one of them. So one thing we can do in the field, guys, if your patient has trauma, you can warm them up. Warm them up. You stop the bleeding and warm them up. That's doing them a huge favor. Those two things alone could save their lives. So next, guys, we have Cobance, a self-adhesive bandage. And this is you can do a lot of pressure dressings with this. If you don't have like a Israeli bandage, which I do have, I'll show you that in a second. But you can just put a bunch of gauze down and just literally wrap this as tight as you can. This works very well. If you don't have that for some reason, this is an ace wrap. If all else fails, put the gauze down, put this on. Also, if you have a sprained ankle, knee pain, wrist pain, that type of stuff, you can put this on. Remember my rice, this is the C, compress, so you can do compression. Down here we have some medicine. I have a Zofran, which is an anti-nausea medicine. Maybe not as important as Benadryl. Benadryl is the single most important medicine you can put in your first aid kit, in my opinion. I need to get some aspirin for my kit, actually. If someone's having some cardiac problems, aspirin is an antiplatelet, and that allows the blood to... It slows the blood from clotting if they're having some type of cardiac event, therefore getting more blood to the heart. Alright guys, if you look over here to the right, I have tons of trauma shears. I have, like I said, I'm an ER nurse, so we do a lot of that stuff. These are Raptor Shoes. These things are awesome. I actually have a whole review on this. I'll put up in the link. These fold out. They have multi-use. You got your ring cutter there, your shears. You have your measuring tape here. This folds out. This is like a seatbelt cutter. And then you have an O2 tank knob right there to turn on. It's more for the old school style. But sorry guys, that totally dropped out of my hand. But you also have a window break here. Let me get that over the white. There you go. So you can just put this in your hand, break a window out. So those are the Raptor shears. Like I said, I'll do a whole video, or I did a whole video. I'll put the review up on that. Neosporin, get a good cut. There's some antibiotic. I also have some triple antibiotic in here. Just call it TAO, whatever you want to call it. But some type of antibiotic is good to have. Paracord. I know most of you guys that do EDC stuff or whatever, most of you guys have some type of paracord on you. I'm not even going to go over why that's good to have. Flashlight. Always want to have some flashlights. I carry kind of a bigger one too. It's just a little easier to handle. Not as bright, but still lets you look in the pack and stuff. Guys, I forgot to talk about this stuff here, the iPad. This is basically if someone has some type of eye trauma. Now, if there is something sticking out of the eye, do not touch it. But you do want to kind of decrease stimulation to that eye. If it's something real small and you can just kind of slightly cover it, an iPad, or you can kind of use some gauze, but be really careful with the eye stuff. You don't want to put any pressure on it. Don't remove anything. Just get them to the nearest hospital, preferably trauma hospital. They probably need a ENT surgeon pretty immediate. Alright guys, here's some more stuff we got here. That's some 4-inch Israeli bandage. These things are awesome. This is not anything we use in the ER. I've never used one of these, actually, but these are great bandages to use. They have a absorbent spot there, and then you can wrap, and then you flip it back on itself, and it can add a lot of pressure on it. So great field bandage. I'm really impressed with Israeli bandages. And then I got a cat tourniquet here. I know some people like rats, cats, whatever. Just have a tourniquet on you guys. The main thing with the tourniquets, if there's bright red blood squirting out, that means there's an arterial bleed. You want to put a tourniquet on. You can first try some gauze and stuff. If that doesn't work though, just go to the tourniquet. The important stuff on that, if you have a marker on you, write the time on there. That's very good for the trauma surgeon to know when they get to the hospital. So yeah, I use a tourniquet if you have one and you're not getting the bleeding to stop. I got some finger tourniquets here. Cpr mask. I tell you guys, if you're not as trained in CPR, if you just want to do the compressions, that's fine. Obviously I do all sorts of resuscitation stuff, so I like to have a CPR mask because I would give breaths. Couple splints here, guys. So there's a finger splint. Basically, wherever finger you want, you wrap this on there, and then you can tape it on for a little bit better security. You can also use popsicle sticks as random splints. Gotta have tape on you. I don't know if I mentioned this, but tape is one thing that I have on me all day at work, as well as those trauma shears. But tape is very good to have on you, obviously, guys. Other stuff we have here, we have hemostats. These are a little bit curved ones. If you need to occlude something or pull something, this even can act as tweezers if you need to. I do have some kind of big tweezers that came in the pack. These are, you know, if someone has a thorn or something, real basic stuff there. Do have some surgical blades here. You guys probably don't need this in your pack. I probably honestly will never use them, but you never know when you need to kind of just get into something a little bit. And something I don't see anybody ever have is some type of water bottle. If someone is bleeding out profusely, or, well, I don't want to say profusely, but someone's bleeding a little bit and you want to cleanse the wound a little bit, you know, good bottle of water, just pour a little bit on that. You know, it'll do the trick. Is it the best thing to use? No, but it's something to put on there to kind of clean it if it's real dirty, muddy. You don't want the patient going septic on you or getting a bad infection. So just put a little bit of water on there, and then you can put the gauze and wrap it on real tight. Alright guys, that kind of wraps it up for my first aid kit. I got some trauma stuff in there as well as some real basic stuff. Hope you guys enjoyed the content. Please like, subscribe, comment, and you guys have a great